Hello and welcome everyone. Welcome to our seminar on anxiety and depression brought to you by Assemblywoman Missy Miller's office and Northwell Health. Please welcome our speaker, Dr. Adina Gabriel.
Good afternoon, everybody. I'm Adina Gabriel. I'm a psychologist at Oceanside Hospital, which is part of the Northwell Health System. And today we're going to talk about depression and anxiety. This is something that a lot of people struggle with, may not recognize that they're struggling with it. And so we have a few goals of this talk today. The first goal is to understand what depression and anxiety are. So what are the symptoms? How do you recognize those symptoms either in yourself or in a loved one? To understand the impact of the ongoing pandemic on the development of these symptoms, to know when to reach out for help, to learn about different options that are available to you when help is needed, and to learn a few practical skills that you can start to use at home on your own independently to manage some of these difficult emotions and situations that a lot of people are experiencing right now. So first of all, what is depression? This is a word that gets used a lot. I think means different things to different people, definitely means something different to lay people than it often does to clinicians. And so let's talk about what depression really is. So when we talk about this in a clinical setting, we're talking about a 2-week period of time during which someone experiences 5 or more of the following symptoms that I will go over with you. For most of the day, nearly every day. So we're really talking about a persistent pattern of low mood and other depressive symptoms that's going on consistently for a 2-week period at least. So you might have moments where you feel a little bit more up, or you might have a positive reaction to a positive event. But if you're feeling low, down, sad, along with some of these other symptoms for an extended period of time, we might be looking at depression. So the first symptom is depressed mood, feeling very sad, feeling very low. Crying a lot are often indications of a depressed mood. Another important symptom of depression is something that we call anhedonia, which is really a loss of interest or pleasure in activities. So people who experience anhedonia aren't really feeling interested in doing very much, not really feeling very motivated. Things that they used to enjoy don't feel very enjoyable anymore. And because of that lack of enjoyment, it also impacts your motivation to seek out more pleasant activities and to have opportunities of enjoying yourself. And these 2 symptoms are the core symptoms of depression. In order to meet a clinical diagnosis of depression, somebody has to be experiencing at least one of those 2. Some of the other symptoms of depression include significant changes in appetite, either increases or decreases. So feeling a lot more hungry than usual, eating a lot more than usual, having difficulty controlling your appetite, or a significant decrease in your appetite. So really not feeling hungry at all, skipping meals, not feeling motivated to eat, not having interest in eat, maybe not deriving pleasure from the food that you're eating. You might also experience a significant change in your weight, either up or down as a result of these things. You also would be looking for some significant changes in sleep. And just as with appetite, this change could go in either direction. So it either could be really significant difficulties falling asleep. So maybe it's taking hours for you to fall asleep. Maybe you're waking frequently during the night, sleeping very restlessly, waking up early in the morning and you find you can't get back to sleep. Waking up in the morning and feeling like the sleep that you've had has not been restful sleep. You also might see it in the opposite direction. So, sleeping a lot more than usual. Sometimes I see patients who have been sleeping, 12, 13, 14 hours a night. They're sleeping a lot during the night. They're taking very lengthy naps during the daytime, still feeling very tired. So we're looking at changes in sleep in either direction, either not enough or too much. Another symptom of depression is low energy or fatigue. So no matter what you do, no matter how much sleep you're getting, still feeling really lethargic, having difficulty getting up out of bed, feeling like even the smallest activity to drain you of your energy, and it's very difficult then to replenish that energy, even with sleep. And even individuals who are experiencing extremely low energy or extreme fatigue might still have some difficulty sleeping, and that's both, those things together is very common in depressive episodes. Also having difficulty concentrating or making decisions, so might be easily distracted. If you're trying to read, for example, find yourself going over the same page again and again and not really, internalizing any of the information that you're seeing. You might have difficulty making decisions, even fairly, straightforward, simple decisions like, what should I make for dinner? Or should I go out and go to the grocery store right now? May seem insurmountable, may seem really overwhelming and stressful. A lot of people who are experiencing a depressive episode also experience feelings of guilt or worthlessness. And when we're talking about guilt, I'm not talking about something transient. I'm talking about sort of like an excessive amount of guilt. If you shared those feelings with someone else, that other people might think that it was disproportionate to the situation that you've experienced. Also worthlessness, feelings of really extreme low self-esteem, negative self-judgment, being very harsh on yourself. There's also some other physiological symptoms that go along with depression. So it's sort of like this physical feeling of feeling slowed down in your movements or your thinking. I hear people describing this sensation almost as though you're walking through water. So everything just feels slow. You feel like you're getting pulled down, but in a very physical way. You also might experience the opposite, feeling very sped up, keyed up, physically agitated or restless, having a hard time sitting still. I observe this often in the form of people like tapping their legs, wringing their hands, pacing around. They just feel like they have to keep moving, sort of describe it as being driven by a motor. They physically can't stay still. Another pretty significant and often very concerning symptom of depression is also having recurrent thoughts about death. So we're talking about things like having, thoughts or feelings of not wanting to be here anymore, wishing something would happen, that you wouldn't have to be here anymore, or even having thoughts of wanting to end your life or thinking about plans or methods for how you might go about doing that. Other common symptoms, so these are not necessary to make the diagnosis, but are very common among people who are experiencing depression. So frequent episodes of crying, feeling hopeless about the future or helpless about your own ability to change things, feeling more irritable, getting more easily angry, experiencing physical pain, engaging in social isolation, so avoiding your friends and family, even when they are being supportive and trying to be helpful, and difficulty caring for yourself or your physical environment. So things like difficulty getting out of bed, getting dressed in the morning, taking a shower, brushing your teeth, either not being able to do those things or those sort of regular activities, we call those activities of daily living, that those activities require you to really push yourself, to force yourself to engage in them. And depression presents differently for everyone. So I just presented a list of all the different possibilities of symptoms for depression, but not everybody is going to experience all of those symptoms. You may experience some of them, but not all of them. You may have depression and a family member may have depression and it may present completely different. And another important thing to keep in mind is that five of these criteria is sort of the threshold for a clinical diagnosis. But anything below 5, just because it doesn't necessarily warrant a clinical diagnosis, doesn't mean that it should be any less of a concern or that it deserves any less attention. So if you're having fewer than 5 symptoms, but you're really feeling very distressed, or you're having a lot of difficulty functioning the way that you normally do, this is still something that you want to take seriously. And another important point is that depression is sometimes situational. It may be a reaction to a difficult situation or problem or perhaps a loss, but it also may not. Sometimes it feels like it comes up out of nowhere and it's hard to understand where this is coming from. And both of those experiences are very common. Now let's talk for a sec about the impact of COVID-19, the pandemic as a whole, on the development of these symptoms. So the world has changed a lot in the last year. We're not engaging with one another. We're not engaging in the world in the same ways that we used to. We've been forced to adapt quite a lot. And that can have a significant impact on your mood and what you feel capable of and the level of distress that you're experiencing for a number of reasons. So we've got isolation. We're not able to see each other as much as we usually do, or as much as we might like to do. And not having that connection with other people that can really have an impact on our mood. As a result of some of that isolation, a lot of us also have a lot less outside help than we often do. So if you're a parent and you haven't had the same access to childcare, let's say, or maybe grandparent involvement or other family involvement, that puts a lot more stress and a lot more burden on you. Also, older family members who may not, who may rely on their younger family members either for caretaking or just for connection, may not have access to that. And especially, among older people who may not be as familiar with technology or feel as comfortable with technology and FaceTiming and connecting with people in that way, it can be very isolating, and it can feel very stressful and sad. Another impact of the pandemic has been burnout. So, we've had to adapt a lot in terms of the way that we do our work and the way that we balance our home responsibilities and our professional responsibilities. There are, a lot less divisions or boundaries between personal life and work life, and it can feel very overwhelming, and you can feel like you're always working on something. And that can be very stressful, and that can lead to burnout, which can also lead to depression. Another impact of the pandemic has been a loss of access to sources of enjoyment. So if we're not doing stuff that we like to do, we're going to have fewer opportunities to feel good. And that's sort of been an unfortunate side effect of this pandemic, is that a lot of the places we like to go have not been open. We've not been able to go be with people and sit in restaurants and go to concerts and museums and all of these things that go to the library, for example, for a while. A lot of these things that we really enjoy doing. And as a result of that, it can have a significant impact on our mood, because if we're not engaging in things that we like to do, there's a lot less opportunity to feel good about things and to find things to enjoy. And then, of course, another significant impact of the pandemic has been increased loss and bereavement. Most people know at least one person who has either been seriously ill from COVID or who has passed away from COVID. And even if you've experienced a loss during the pandemic, even if it's not COVID related, we've had to deal with and process these losses in a very different way. We've not been able to gather together as much as we would have been in the past, and that family mourning process is a significant part of the grieving process. And when we're not able to do that, we end up carrying around a lot of those feelings, which can also lead to depression. So we talked about what some of the symptoms are. These are things that you might be on the lookout for in yourselves. It might be easier to connect with some of these ideas, but it may not look the same if you're observing it in someone else. So let's talk about what it might look like if you're trying to detect that in a loved one or a friend. So you want to be on the lookout for things like, does this person seem more sad than usual? Are they crying frequently? Do they seem to not be able to cheer up in situations that should be cheerful or that you would expect to be cheerful? Are they not sleeping well? Are they having a hard time falling asleep? Are they waking frequently? Do they seem to be tired all the time? Do they seem to be very low energy, even if they are telling you that they're sleeping okay? Are they struggling to keep up with the activities that they used to do pretty easily? So we could be talking about those activities of daily living that I mentioned earlier. We could be talking about work, we could be talking about household responsibilities, physical activities, but whatever the case may be, does it seem like they're having a harder time doing those things than they might have in the past? Have they been less responsive to communication? Are they keeping to themselves more? Does it seem like they're isolating themselves? Are they ignoring phone calls and texts, not just from you, but from other people as well, maybe? When you ask them if they want to come out, are they coming up with reasons to never leave their homes or to not come and socialize? And is this out of character for that person? Lots of people are homebodies. They don't necessarily like to go out, but is this a significant change in the behavior for your loved one? Are they usually someone who is very active and social, and now they're starting to sort of retreat into themselves? Similarly, is it harder to engage them in activities? So if they're usually a person who is very active, who's willing to do a lot of things with you, do you have to push harder? Do you have to ask more times before they agree to do those things with you? And also pay attention to, has their self-care started to slip? Does it seem like they're having more difficulty maintaining their hygiene, maintaining their grooming, taking care of themselves physically? And is this out of the ordinary for that person? So let's switch gears a little bit. And now we're going to talk about how to identify anxiety. So anxiety is an experience of very frequent and intense worrying that occurs on more days than not. And you might notice that for both depression and anxiety, one of the keys is sort of like most of the time. So not that you're experiencing like little like discrete periods of time where you feel really sad or down, or where you're feeling pretty nervous or anxious, but that this is starting to be the norm rather than the exception. You're feeling this way most of the time, more often than not, even if there are times when you're feeling some relief or getting a bit of a break from those experiences. It's also difficult to control the worry. So your brain is sort of flooded with this anxiety, with these concerns, with these worries, and it seems like no matter what you try to do to manage those concerns, nothing is working. And this frequent worrying that's difficult to control is also associated with 3 or more of the following symptoms. So feeling restless, keyed up, on edge. So again, like having a hard time sitting still, pacing, feeling very shaky, shaking your legs, tapping your feet, wringing your hands, feeling like you got to get up, walk back and forth. It's just, I hear people describe it as sort of like this feeling of like you're gonna jump out of your skin. You feel so uncomfortable, so keyed up that you just feel like you're gonna jump out of your skin. Also feeling very easily fatigued. So, it doesn't take very much to make you feel tired. Either your energy is consistently low, or when you engage in sort of your regular daily activities, it takes a lot more out of you than it usually does. Having difficulty concentrating. So being very easily distracted by your worries, finding it difficult to focus on one thing, find your mind jumping around a lot, or just, going blank sometimes, but really having difficulty finding your focus and maintaining your focus. Feeling irritable or easily annoyed. So oftentimes anxiety gets expressed as irritability or anger. So you've just got so much worry and you've got this agitation, and it just comes out as snapping at people. And sometimes in the moment you can recognize that you're not being rational. Sometimes it's more difficult to recognize that. Sometimes it absolutely feels like it is the rational response, but being more prone to anger, quicker to anger, having a shorter fuse. People also experience anxiety in a very physical way. So a lot of muscle tension. I hear people talking about very often in my work, feeling like, like their shoulders are up around their ears all the time. So you're carrying a lot of tension in your shoulders, your neck, your upper or lower back, but experiencing, you're so tense and anxious that it's actually causing you physical pain in your body. Having difficulty falling asleep or staying asleep, or having restless and unsatisfying sleep. So, people who experience really intense anxiety find themselves laying in bed at night for hours, going over their worries and concerns and feeling so anxious about these things that they just can't get any rest. Other common symptoms of anxiety that are not necessary criteria to meet the diagnosis, but that are very common and very frequent, include GI symptoms. So people very commonly report that they're experiencing nausea, vomiting, diarrhea that is strongly connected to their anxiety, and that's because some of the same receptors that are in your brain are also in your gut, and so there's a very strong connection between your brain and your gut in terms of the way that anxiety is experienced and expressed. Also rumination. So rumination is 1 or 2 thoughts that you just find yourself getting stuck on. You go over and over and over it in your mind. It's very difficult to think about other things. You just can't let go of it, and it interferes with your functioning and your ability to focus on what you need to. Also intrusive thoughts. So these might be thoughts that kind of like pop into your head unbidden, feel very foreign, feel concerning, might feel out of character. So sort of being like where is this thought even coming from? Like, why is this here? I've never felt this way before. And those thoughts can be very troubling as well. And also panic attacks. And so panic attacks are very strong physiological expressions of anxiety where people experience multiple physical expressions of anxiety simultaneously. So things like shortness of breath, racing heart, shaking, sweating, tingling in the hands and feet, dizziness or lightheadedness, sort of like this sense of impending doom, feeling like you're going crazy. So experiencing several of those symptoms simultaneously in a very intense way is what we would call a panic attack. And to meet criteria for a clinical anxiety disorder, the anxiety has to be persistent for a period of at least 6 months. So for 6 months continuously, you're experiencing these symptoms most of the day, nearly every day, with little relief. And just as we discussed with depression, anxiety is going to present differently for everyone. Everyone feels it in a different way. Some people experience it more cognitively, so more in terms of the worrying and the ruminations and the intrusive thoughts. Some people experience it more physically, so more of the muscle tension, the panic attacks, the GI symptoms. Some people experience a mixture of both, but there's a lot of variability here. You may experience some of these things, but not all of them. And they may not have been present for an extended period of time yet. And just as with depression, it can be situational. Anxiety can be an emotional response to a difficult situation, or it might not. Again, it often just feels like it comes up out of nowhere. Sometimes it's hard to identify why this has started, why now, or in response to what, and both of those are common experiences. And also, just as I mentioned with depression, if you experience fewer than 3 of these symptoms, but you're feeling really distressed, it's really emotionally overwhelming, or you're having difficulty functioning, difficulty doing the things that you normally do, you should still take it seriously. And let's talk about the impact of the pandemic on the development of anxiety. So there's been a lot of hypervigilance about illness and germs over the last year plus. So, being told to constantly be on the lookout, have your hand sanitizer, wear your mask, make sure you're, keeping social distance, you're not going certain places, you're not interacting with certain people or under certain circumstances. And so we're really being told all the time, you need to be hyper aware of this. And that can cause a lot of anxiety, particularly for people who are already prone to anxiety or concerns or worries about germs and health. We're hyper vigilant about physical symptoms. Like, what does this mean? I mean, my daughter's going to school, and every morning I have to fill out a questionnaire for her on an app that asks her temperature and is she experiencing any symptoms. So, if the answer to any of those questions is yes, I can't send her. So every time she has a little sniffle or a sneeze, I'm like, is everything okay? Like, are you all right? So we're really being told we have to be extra careful and extra watchful about these things. And it can be anxiety provoking, both in terms of thinking about our own health, but also the health of our loved ones. COVID has also had a really significant impact on people's financial situations. So people who have lost their employment, who might be having difficulty making ends meet, there's going to be a lot of anxiety surrounding that. There's also a lot that we can't control as a result of the pandemic, and maybe particularly the behavior of other people. You could do everything right. You can take every precaution and follow every recommendation, but you can't control what anybody else around you is going to do. And so there's going to be some measure of risk here, and it can be very anxiety provoking for people to not be in full control of their environment. Also, as restrictions are starting to be lifted, there's like more flexibility for us to make decisions for ourselves about what feels safe or what feels okay. And that also can be anxiety provoking. If we're not really sure what the right thing to do is, it can feel like there's too much space to make our own choices about how to get back into things, and that can be anxiety provoking because we don't want to make the wrong decisions. We don't want to take unnecessary risks, and sometimes it can be hard to ascertain which risks are necessary and which ones we are not necessary, which ones maybe we shouldn't be taking. And not having clear guidance all the time can add a lot more stress to that decision-making process. And also, we can't predict the future. And a lot of anxiety is about worrying about what's going to happen in the future. A lot of anxiety is anticipatory. So what's going to happen and what am I going to do if that thing happens? And when we can't predict the future and we certainly can't control the future, there's a lot of heightened anxiety surrounding that. So how do we notice this in a loved one? We talked about how do we recognize it in ourselves? How might we recognize it in someone else? So do they seem nervous? Do they seem like they're worrying a lot? Do they seem a lot more concerned about things than they used to or than they normally are? Are they very restless? Do they have difficulty sitting still, pacing a lot, always in motion even when they are sitting down? Do they seem to worry about everyday concerns more than they used to, or more than most other people would? So maybe they're having normal concerns, but they're getting stuck on those things. They can't move on from those concerns, or you might feel that their concern about those things is disproportionate. They're more worried about it than maybe you feel they should be, or other people feel they should be. Is it starting to become difficult to have conversations with them because they become easily distracted by their worries? Do they seem more short-tempered more impatient than they usually do? Are they snapping more? Are they getting angry more quickly or more frequently? And have they started to be more fearful about engaging in the world? So are they isolating more, staying home more, not interacting with other friends or family because they seem to be more fearful about doing that? Are they more concerned about the future than they used to be, or that you feel they ought to be? So all of these are important indicators that somebody that you care about might be struggling with some increased anxiety. So we all feel down from time to time. We all worry about things. We all feel anxious from time to time. That's all very normal experience. So how do we know if this is serious? How do we know if we've crossed the line from sort of normal, understandable reactions to certain stressors to something that is of clinical concern? When do we know when it's time to get help? So my short answer is anytime you want. There is no right or wrong time to get help. If you want help, if you feel you need help, go get it. There is no threshold that you need to meet to seek mental health support. You don't need to meet criteria for a psychiatric diagnosis to seek support. So there's no floor that you need to meet in order to say like, okay, now it's all right for me to go get some help. If you're struggling and you want help, go get it. If feel like you don't have the skills, the coping skills that you need to manage your anxiety or to deal with situations, if you're feeling overwhelmed with emotions and you don't know how to get through that, even if you're only experiencing 1, 2, 3 of the symptoms that I mentioned, go get help. Because if you're motivated and you're interested in learning to approach situations differently, you will derive benefit from it. So it's never too early and it's never too late to ask for psychiatric help or for mental health support. Okay. So if we're trying to sort of distinguish what is a normal emotional reaction to a difficult situation, what's a transient emotion, what's going to be temporary, what's going to pass quickly, versus something more concerning, something more intense. What are some of the criteria that we look at to sort of make that determination? So the first one is duration. How long have you been feeling this way? How long have you been feeling sad? How long have you been having uncontrollable crying spells, not been able to sleep? How long have you been feeling as anxious as you've been feeling? And you also want to look at how persistent it is. So, is it most of the day, every day? Is it ongoing? Do you experience it for a day and then, a week in a row, you feel pretty good and then it comes back for a day? So if you've been experiencing a number of these symptoms for an extended period of time, so for depression, I said it was at least 2 weeks. But even if you've been experiencing a lot of these symptoms for a period of 1 week, if these things have been going on for a while and it's unusual for you, that's something that you want to pay attention to. Another thing that we look at is the intensity. How strong are these symptoms? So if you've been experiencing them for a while, but they're really not that intense and you can manage them and it's not impacting your functioning, it's not impacting your thinking, then maybe it's not a concern for you. But if the feelings are very strong, then we want to be paying attention to this. So are those feelings interfering with your ability to think clearly? Are they interfering with your ability to focus on your work, to effectively make decisions? Do you wake up and your whole day just begins and ends with these feelings? Is everything revolving around these feelings? Are these feelings and experiences so strong that other people in your life have begun to notice them and comment on them? And are you feeling like yourself? Is this out of the ordinary for you? Are you just not feeling right? So, let's say you've been having these experiences for maybe just even a couple of days, but they're so strong that you really don't feel like yourself. You really feel like you can't function the way that you normally do. Then again, this is something that we want to be paying attention to. This is something that we want to be looking at a little bit closer. So if the distress is more than you can tolerate or manage, so we call this clinically significant distress. If it's more than you can handle, if you're feeling overwhelmed, if it's too intense for you to be able to cope with it effectively, and if you're struggling to maintain your functioning, so you're not able to, either you're not able to, or it takes a lot more effort for you to do the things that you need to do, then it's time to ask for some help. So let's talk about the potential benefits and potential pros and cons of seeking mental health support. So there are a number of pros, in my opinion. You'll learn more about yourself. You'll understand better the way that you react to things. the way that you see yourself, the way that you see the world. You'll learn how, maybe you'll be able to identify how your life experiences have informed your identity, have informed the way that you interact and engage with the world, and you'll have a better understanding of yourself. You'll also have access to non-judgmental and objective support. That's really what you get from a therapist. So you may have supportive family members in your life, and they may do everything possible that they can to support you, but they're not going to be objective because they're in it too, and they want you to feel better. And they may not be able to see situations objectively because they're involved in them as well. And so if you seek mental health support, then you'll have access to someone who is objective and who's also not going to judge anything that you tell them. This is what they are here for. They are here to listen to your difficulties. They are here to help you with those things, to help you work through those things. No therapist is ever going to judge anything that you bring to them. They are here to listen and to help. You'll also have access to normalization. So one of the biggest barriers I found to seeking mental health care is that people feel very alone in it. Maybe they don't recognize that this is a common problem, recognize that this is something that a lot of people struggle with, and so they keep it to themselves. They keep quiet about it because they don't want to share that. Maybe they're embarrassed to share that. But one of the benefits of seeking mental health support is that one of the things you learn is that it's not just you. Other people have been here. Other people are here. You're not alone. You can learn from others. Others can support you. Others can guide you. And that can be enormously beneficial. Another benefit is you can learn how to manage your emotions more effectively. So the goal is not really to get rid of emotions or to avoid emotions, because we need our emotions. They serve a very important function in our lives. And also it's impossible to ever avoid stressful situations unless you avoid the world at large. So the goal isn't to avoid your feelings or get rid of your feelings, but to really learn how to manage them more effectively. You can learn a lot of different tools so that when stressful situations come up, when difficult emotions come up, you're prepared. You know what to do. You know how to manage this. And the feelings are a lot less likely to overwhelm you because you've got your coping skills available and you know how to use them. You'll also be taking better care of yourself. So, I think that mental health care doesn't get nearly as much positive attention as it should. I think when we think about healthcare, we often, people's minds usually go to going to see your primary care doctor, make sure you're eating right and you're sleeping right and these kinds of things. But it's important to take care of your mental health as well. It's really an investment in your future well-being and your future happiness and your future functioning for you to spend the time to get to know yourself a little bit better and learn how to take care of yourself a little bit better on an emotional level as well. And you'll start to feel better. If you go and you engage and you're open to what your therapist has to say and you're open to looking at things in a different way and learning some things you might not be familiar with, chances are you're going to start to feel better. Let's talk about what the downsides are. So honestly, I have no idea. I mean, I personally don't see them. I really don't think that there is anything that is unhelpful or unhealthy or damaging about seeking mental health support. That being said, I think that there are some common concerns that people share and some common misconceptions, and I think it's helpful for us to address them. So one thing that I hear a lot is, well, I'm not crazy, sick, mentally ill, fill in whatever derogatory adjective you want in there. So therapy is not for me. As I mentioned before, there is no threshold for requiring mental health services or mental health support. If you want it, go get it. So you don't need to be seriously ill. You don't need to be on the brink of a psychiatric hospitalization in order to need therapy. Therapy is a way, as we discussed, to get to know yourself better, to understand yourself better, to learn some tools for navigating the world better. So there is no threshold that you need to meet in order to be, quote unquote, sick enough to benefit from mental health care. Anybody can benefit, in my opinion. Another common concern I hear is, what will people think if they find out that I'm in treatment? First of all, nobody else needs to know if you don't want them to. Everything that you say in a therapist's office or a psychiatrist's office is 100% confidential. Your clinician will never share that information with anybody else unless you have given your explicit written permission to do so. So if you don't want people to know that you're seeking mental health support, nobody ever has to know if you don't want to tell them. That being said, if you want this service, if you feel you're going to benefit for it, that trumps everything else. You should be more focused on taking care of yourself than managing other people's reactions to it, because that's their problem and not yours. I don't want to take medicine is another common concern that I hear. You don't have to. It's certainly available to you if you want it or need it. It can be extremely beneficial and helpful. There's a lot of research that shows that for mild to moderate depression, a combination of medications and therapy is more effective than either medications or therapy alone. So there's certainly a place for it, but there's no obligation. If you want to do talk therapy and learn tools and you don't want to take medicine, that's perfectly fine. Another thing that I often hear is, how is talking about my problems supposed to make them go away? Well, for one thing, it's way better than not talking about them. If you're holding things inside and you're not processing them and you're not getting any support, you're not going to feel better. It's going to build up to the point where everything kind of explodes or melts down. But also, therapy isn't just about talking about things. It's also about listening and getting feedback and learning to look at things in a different way and learning to manage things in a different way. So it goes beyond just, like laying on a couch and spilling your guts, although that can certainly be beneficial for a lot of people. And I respect that approach as well. And maybe that's what you need, but maybe there are going to be other times in your life when you need a little bit more direct approach. And all of those things are available to you. There's a lot of different things that are available to you that go beyond just talking. And another concern that I often hear is, I wouldn't feel comfortable sharing personal things with a stranger. And I can understand that as well. One thing that's very important when you are seeking mental health support is finding a good fit between yourself and your clinician. So somebody that you feel comfortable with, somebody that you feel you can trust. And, I always encourage people to give it a couple of sessions, even if you don't hit it off immediately, give it a couple of sessions, see if you can develop a connection with that person. But if you've seen them a few times and you're not feeling it, it's okay to find somebody else. Shop around until you find somebody that you do feel comfortable with. Because if you don't feel comfortable with somebody, you're not going to be honest with them. You're not going to be open with them. And then you're not going to get as much benefit out of it as you possibly could. So take a little time, shop around, find somebody that fits with what you are looking for and who you feel comfortable with. And an important takeaway here is mental health care is healthcare. And we want to treat it the same way. Give it the respect that it deserves, give it the attention that it deserves, the same way you would any other kind of healthcare issue. So what options are available if you are interested in seeking mental health support? We've got therapy, first of all. Individual therapy, so there are a lot of different providers who you can work with. You can see a psychologist, a social worker, a licensed mental health counselor. There are other master's level clinicians who are licensed who are licensed therapists, so a lot of different options in terms of individual therapy. There's also group therapy available. I run a lot of groups. Sometimes people are a little bit wary of groups, kind of sharing their personal experiences in a big group of what feels like strangers, but there's an awful lot of benefit to group therapy. It gives you an opportunity to get some of that normalization, to connect with other people who are going through some of the same things that you might be, to get support, to learn from their experiences, to feel connected and to not feel so alone. So there's, you could do one or the other. They support one another very nicely, so you could do both, but these are some really great options available. There are also support groups. So group therapy is run by a mental health professional. Support groups are peer-led. So you would still be in a group of people who are having similar experiences, who are going through some of the same things. But in a support group, there's not like a group leader. It's a peer-led group where people just offer their support and feedback to one another. And if that's something that you're interested in, I highly recommend that you check out NAMI, which is the National Alliance on Mental Illness. It's a really excellent organization that has a very active chapter in Nassau and Queens. And I put the website here, but they have a lot of different local support groups. They have groups for family members who are supporting a loved one with mental illness. They have I think like 8 or 12-week psychoeducation courses where they teach about different mental illnesses. There's also a lot of information on their website about different diagnoses, including but beyond depression and anxiety. So it's just a really excellent resource all around for learning about mental health. Also got medications if that's something that's of interest to you. You can see a psychiatrist, you can see a psychiatric nurse practitioner. I always recommend that you see a mental health professional to get mental health medications. Most primary care physicians will prescribe like some basic antidepressants, anti-anxiety medications. My personal feeling on the subject, and this is only my opinion, is that, just like you would want to see a specialist if you were having a heart problem or a kidney problem, you want to see a specialist if you're having an emotional difficulty. Psychiatric nurse practitioners and psychiatrists are specialize in this, and they know what they're doing and able to see things with much more nuance and have a lot of experience. And so, it's better to see your primary care doctor than not to seek that support at all if that's something that you want or feel you need. But if it's at all possible, I often recommend to people that they try to see a specialist, because you may benefit from their experience. How do we go about finding a clinician if we want to? So one thing you can do is call your insurance company, because they will be able to tell you exactly who locally accepts your insurance. If insurance isn't a concern, you can find your own private clinician if you are able and willing to pay out of pocket. Another really helpful tool is Psychology Today, which is a popular psychology magazine publication. They've got a great tool on their website to help you find therapists. And you can search by a lot of different search terms, the type of insurance that they accept, whether it's a male or female, if they're seeing people remote or in person, the types of therapy that they practice, that they feel that they're qualified to practice. So it can help you get, really specifically what it is, whatever it is you're looking for, it can help you find that. Also, again, NAMI is a great resource for this. So they have a helpline. You can either, there's a website, there's a phone number, there's an email address that you can use, and if you reach out to them and you let them know what type of insurance you have and what kind of service you're looking for, therapy, psychiatrist, groups, they can help to link you up with something in your local area. And you can also ask your primary care doctor for recommendations. They usually have a few names available to them that they can refer you to, that you can try and get an appointment with. And also, asking around friends, family for personal recommendations is always a good thing as well. So now let's talk about what you can do on your own. So we've talked about who can you reach out to. Maybe you're not ready to do that. Maybe you don't think you want to, or maybe don't feel you need to, but you want to learn some tools to help you manage some of the difficulties that you're experiencing. So sort of the first important consideration is you want to pick the right skill for each situation. There are hundreds, thousands of coping skills out there, but not every skills are not one size fits all. So a skill that's good in one situation is not going to be very effective in a different situation. And so it's helpful to identify at the outset, what is the goal? What am I hoping to get out of this? How am I hoping to feel when I'm done? And to use that to sort of guide the kind of skill that you choose to practice. And there are two large groups that we divide these skills into. We have emotion-focused coping. So this is when you're trying to manage the emotion. You're trying to regulate an emotion, sort of dial down the intensity of it. We also have problem-focused coping skills. So these you would utilize in situations where there's a real concrete problem that is solvable, and these skills are aimed at helping you to figure out how to go about solving that problem or changing that situation. So let's talk about problem-focused coping skills first. The first skill that I want to tell you about is called problem solving. So again, this is for a situation where there is a concrete identifiable problem, and it's a situation that can be changed. There is something that you can do to solve the problem. So the first step in problem solving is doing a behavior analysis. So what this means is you really break down the problem. You step by step, you look at it carefully. What is the difficulty? What's holding you back? What's your role? What are other people's roles in this situation? What is happening? Why is it happening? What has led up to you being in this situation? What are the events and the occurrences that have led up to you being where you are? So trying to get as specific as possible about what the situation is, why it's happening, what is perpetuating it. The second step is taking a look at which aspects of this problem can you change. So some of the situations are not going, some of the aspects of the situation rather are not changeable. So other people, for example, you can't change other people. So you don't want to focus on trying to do that because it's not going to be effective and you're going to end up being frustrated. So looking looking through that behavioral analysis and assessing which of these elements might I have some measure of control or influence over, and which of these areas may I not. And focusing in on the areas where you may be able to have some control or influence. The third step is brainstorming alternatives. So this is what I've been doing, is basically what the behavioral analysis is. And brainstorming alternatives is about, okay, well, what else can I try? What have I not tried? What have I not tried? What have I not previously considered trying? What has gotten in the way of me trying other things? And in this step, the first part of it is you're not even thinking necessarily about what's going to work or not. The brainstorming piece is about generating as many ideas as you possibly can for addressing or confronting the situation, for meeting the situation head on. As you generate this list, then you're going to start to go back and look through each of these possibilities and say, okay, which of these are more likely to work? Which of these are less likely to work? Then you're going to rank them. Which is most likely, all the way down to which is the least likely to be effective. And that takes you to step 4, which is you put the solution into action. You start with the top of the list and you implement each of those solutions, and you keep going until you find one that works. And if you make it all the way through the list and none of them have worked, then you go back to step 3. Let's brainstorm some more alternatives. Let's get opinions from other people. Let's see if we can generate some more potential solutions to this problem. And by solving the problem, ultimately, you remove a lot of the stress. And so the emotions start to come down naturally on their own. Another problem-focused coping skill that I often teach is called coping ahead. And this is really useful for anxiety in particular. So as I mentioned earlier, a lot of anxiety is anticipatory. It's worrying about the future. What's going to happen? And what am I going to do if X, Y, or Z happens? The goal of coping ahead is to address exactly that, the what am I going to do feeling that comes along with anxiety. By sort of imagining what you would do, imagining how you would feel in an anxiety-provoking situation and how you would respond to that anxiety, how you would cope with that anxiety in the moment. So the first step is identifying the feared situation. So what is it that you're afraid of? What is it that you're concerned about, that you're feeling anxious, that you're worried about? And in as much detail as possible, imagining that situation, describing that situation, and try to imagine it in enough detail that you almost feel like you're there, that it brings up those feelings of anxiety and whatever else you might be experiencing. So you can experience those emotions in a scenario that makes you feel safer because you're not actually there yet. The second step is when you're imagining yourself in this situation, you're starting to feel the things that you might feel in that situation, thinking about what can I do to manage the way that I'm feeling? What skills do I have to survive my anxiety, to bring my anxiety down that I could use if I found myself in this situation for real? And then the third step is to rehearse that in your head. Imagine yourself doing it. Imagine yourself using the skill. Imagine yourself feeling better as a result of doing that skill. Noticing the change in the way that you feel when you imagine yourself doing it. So if you were starting to feel anxious just by imagining it, and now you've imagined yourself surviving it or excelling in that situation, notice how that feels also. And the idea here is you're practicing ahead. If you've already practiced the situation in your head again and again, you're going to feel prepared to do it when you're actually there. And there's actually a lot of research that shows that imagining yourself doing it strengthens the neural connections almost as much as actually doing it. So if you're a musician and you imagine yourself playing a particular piece of music, you're still gonna see improvements in your performance. You don't have to actually just be playing the instrument, but imagining yourself practicing things can strengthen those neural connections and can help you do it more effectively when you do find yourself in that situation. And that's the idea here. We're preparing. We don't need to wait until we're in the situation to figure out how to deal with it. We can do that in advance. And now let's talk about a couple of emotion-focused coping skills. So if you're in a situation where you can't solve the problem or you can't change the scenario, you can still manage your emotional reaction to it. And so a really fantastic, effective, wonderful skill that I teach most of my patients as a basic skill is mindful breathing. There are a few apps that you can download that are really excellent. Calm and Headspace are two of the most popular ones. If you Google mindful breathing or guided breathing meditation, you'll get a ton of scripts and YouTube videos that are available as well. And there are a lot of benefits of doing mindful breathing. Mindfulness in general is about sort of reclaiming your focus, reclaiming your attention, not trying to change the way that you feel about things necessarily, not trying to change situations, not clinging to negative thoughts and getting stuck in them, but also not trying not to push those things away, but learning to sort of coexist with the difficult emotions and difficult thoughts that you might be having and manage them more effectively. So some of the basics of mindful breathing: first, you want to find a comfortable space to sit comfortably in your comfortable chair. And you want to just be focusing on the physical sensations of your breathing. So closing your eyes, breathing in through your nose, out through your mouth, taking slow breaths, counting, and just really trying to focus your attention as much as possible on the sensations of your breathing. You're not trying to change your breathing in any way. This isn't about control. This is about noticing. This is about being aware. It's about not trying to have any expectations about what you're going to get out of this or how you're going to feel. And it's really just about simple awareness of your breath from moment to moment. And what mindful breathing really does is it allows you to refocus on what you're experiencing here. You're not as focused on what's going on out here or up here, but you're taking control of your attention. You're sort of choosing actively that you're not going to let the thoughts and the worries be in control anymore, that you're going to start to be in control. You're going to be okay with whatever is going on around you. And if you need a break from difficult thoughts or a difficult situation, this is how you can do it. Sort of reclaim that time for yourself. And another really excellent, sort of preventative and responsive skill that we can utilize to manage our emotions is by taking care of ourselves, which often falls by the wayside, especially when we're having a difficult time emotionally. So we've got this acronym, PLEASE, which is several steps to positive and healthy self-care. So the PL is for treating physical illness. So making sure you're going to all your regular doctor's appointments, you're taking good care of yourself. If you're feeling physically unwell or you're feeling physically ill, checking in with the doctor and making sure that you're addressing any kind of medical or physical complaints that you might be having. Because when we don't feel well physically, we're not going to feel well emotionally either. The E stands for balancing your eating. So making sure you're eating enough, you're not overdoing it, you're eating healthy foods that are nourishing to your body, you're allowing yourself to have treats sometimes. Treats in moderation are perfectly acceptable, if not good. You're not denying yourself those things, but you're making sure that you also have a good balance in your diet where you're eating healthy and nourishing foods as well. The A stands for avoiding mood-altering drugs. It's okay to have a glass of wine sometimes, but if you find that you're, drinking a bottle of wine all by yourself alone every day, or that you got to have a drink first thing in the morning when you wake up, that's not particularly healthy or effective or adaptive. A lot of mood-altering substances, alcohol, marijuana can have a significant impact on your mood, and that's just something that you want to be aware of if that is the case for you. Oftentimes in mental health settings, we do ask people to refrain from drinking or from using substances, not because we necessarily think that there's anything wrong with them necessarily, depending on what substances we're talking about, but because they can exacerbate symptoms, and sometimes it can be difficult to know what's the depression and the anxiety and what's the impact of the substances as well. So if you're really struggling with your emotions, if you're struggling with your functioning, if you're struggling with really significant, serious distress, you might want to take a little break from some substances and just to see how you feel, to see if there's any difference in how you feel, any improvement in how you feel. So again, we're talking about moderation here. We're talking about balance. The S stands for sleep. So making sure you're balancing sleep as well. You're getting enough. You're not getting too much. I always encourage people to refrain from napping during the day as much as possible, just because it can interfere with your nighttime sleep. And if you're not sleeping well at night, chances are you're not going to feel very good the next day. And then the E stands for exercise. So you don't have to go run a marathon. This could just be going for a walk around the block a few times a week, but getting some physical exercise. Physical exercise releases endorphins in your brain, which is sort of the body's natural antidepressant. So you're likely to see a positive impact on your mood from engaging in regular exercise. And it's also good for your physical health. And that takes us right back to the P at the top of treating physical illness and making sure that you're maintaining your physical health. And that is the conclusion of what I have to share with you guys today. And thank you so much for coming and for listening.
Thank you, Dr. Gabriel. That was a fantastic and informative program. Thank you so much.
Thank you.